I'm Denise, and I'm going to be the host today and the speaker. And I just want to welcome everybody. And I can see, Kathy is here, and Lonnie is here in Mississippi. And I'm Denise. I'm in New Hampshire, actually. And it's great to have you here. I'm so glad that you are all able to join us. I know Yvonne is here from New York, which is wonderful. Okay. And so I'll introduce myself. I'm a respiratory therapist and certified asthma educator, as well as the Nightingale program manager at Nightingale Virtual Respiratory Care by Healthcare Originals. So, on behalf of the Nightingale staff, I would like to welcome you and thank you for taking a few minutes out of your afternoon to participate in our third live session. The first two sessions, Jan's medication devices and Sarah's moving more, are pinned to the top of our Nightingale's Facebook group pages. And this one will also go there. So anyone who wants to watch it again or maybe missed it today, wasn't able to make this time slot, they will be able to watch it online. So in the chat, please type, if you haven't already, please type your first name and the state of where you're from so we can see how far and wide we are reaching people today. Also, please write any questions you may have, and we'll get to those during the session. I have one of our RTs, Cindy, in the background here, and she's going to help with that. So, as mentioned, this session will be pinned at the top of our Facebook page in the near future, so you can watch again or anyone else can watch it. All right, I'm going to get started in the interest of time. So before I begin, hi, Jared, and hang on. So before we begin, I'd like to remind you that these tips on manage your cough and mucus are general information. Always talk to your healthcare provider about the best options for your individual case. All of us have different medical histories. And after you, because obviously you know yourself best, your healthcare provider knows you best. Today's topic, manage your cough and mucus, is something that respiratory therapists get asked a lot. We have also seen many comments and questions on the COPD Heroes social group by Nightingale Facebook group discussion regarding this topic. And excess mucus is also something that happens to people with asthma. So let's dive in. First off, what is mucus and why do we have it? Mucus, also known as phlegm or sputum when it's produced in your respiratory system, lines the tissues of your body, such as your nose, mouth, throat, and lungs. Mucus traps irritants such as smoke, germs, dust, and chemicals in your airways, and mucus helps your body to expel the irritants through coughing. This helps protect you from infection. In turn, when you have an infection, your body produces more mucus to fight the germs, and then you need to cough up all that extra phlegm to help you recover. People with asthma and COPD generally make an excess of mucus because they have an increased number of cells called goblet cells that make the sputum. People with COPD may have trouble coughing up the phlegm due to damage in the airways and weakness in the muscles near the rib cage in the thoracic area, because this is the area you want to use to cough and move the phlegm up. And if this area is getting weaker, these muscles, it's harder to get a good cough going. We also have what's called the mucociliary escalator. And what that is, it's tiny hair-like structures that move up and down like this in like your trachea or your windpipe. And they move the phlegm all the way up so that you can cough it out. And when those cilia become damaged or sluggish, which happens in COPD, it can be difficult to get the phlegm to come up so you can cough it out. In asthma, there's an overproduction of thick sputum due to inflammation or swelling in the lungs, and that can make it difficult to move the mucus up that mucociliary escalator. And this model will show you. Now, in full disclosure, this is from a pharmaceutical company that I got this. And what it is a normal airway here is nice and open and it's not inflamed and the muscles are nice and open. Over here, we have someone who may have COPD or asthma with a lot of swelling and inflammation going on. This is supposed to be mucus, so you can see there's a lot of mucus being produced right there. And the blue is supposed to be tightening up of the muscles so that it makes it harder to breathe, because obviously it's going to be a lot harder to breathe through something that's so clogged up like this than with something that's nice and open. Those are some of the reasons why people might have some problems trying to get the phlegm out. So when the phlegm pools in your lungs and you're unable to cough it up and get it out, it can actually cause an infection, thereby doing the opposite of what the sputum is supposed to do. So then the phlegm also can block those airways, and that can contribute to your shortness of breath. So how do we get the phlegm out? And there's no one right way that works for everyone. You may recall that it is, we did a quiz on our Facebook pages where we asked a question about what is the best way to get the phlegm and mucus up. And 51% of the asthma heroes said D, all of the above, while 72% of our COPD heroes also agreed with that it was D, all of the above. So, guys and gals, you are the voice of experience and expertise in managing your mucus. You should be proud because all of that is correct. And so we'll go through those options that we talked about in the quiz, and we'll add a few other extras just to give you a little more information on how to move some phlegm. First, on the quiz, answer A was drink water. And yes, that is true. Keeping your sputum moist will thin the mucus and help it to move. You want to remember that the mucus in asthma and COPD can be thick. So you want to be able to thin it, and then it'll move a lot easier. Now, one caveat to that is if you are on a fluid restriction from your doctor, you always want to follow whatever your doctor says. So if he said, I only want you to drink X amount of fluid a day, then you stick with what the doctor says for you. But if you're not, if you're like the rest of us that are not on a fluid restriction, generally we would say to drink 6 to 8 ounce glasses of water a day or fluid. This shows you what 8 ounce glasses of water a day would be, 64 ounces. Now, I want to dispel a couple of myths. We used to say that don't count your caffeinated beverages because caffeine does dehydrate you. Well, it is true that caffeine dehydrates you, but the studies have found that when you have like this mug of tea or coffee, this is a 14-ounce mug, and that's a pretty average size mug, that the amount of fluid that's in here negates or counteracts the amount of caffeine that's in a cup of coffee or a cup of tea. So that now we do count this. So if my 64 ounces that I need to get a day, I can minus the 14 from this, and that brings me right down to how much more I need to be drinking today. Also, dairy. I hear a lot from people, oh, I don't drink any dairy or anything because that's going to make more mucus. That's not exactly true. Dairy will not produce more mucus, but dairy products can make your mucus thicker, and that can make it harder to cough up. So some people with asthma or COPD may feel better avoiding dairy, especially when they're experiencing a flare-up. I myself, last week, I had a cold on top of my asthma, and yeah, I didn't even want to have any kind of milk. Like you just don't even have the taste for it at that time. I find it's kind of like your body's way of saying, oh, we don't need that right now. The second option on the quiz, answer B, was about controlled coughing or huff coughing. Controlled coughing helps to loosen the mucus and helps it to move through the airways. Uncontrolled coughing fits cause your airways to collapse and spasm and trap the mucus. So those are not beneficial. So coughing techniques such as the deep coughing or huff coughing can be helpful to get the mucus up and out. These methods are less tiring and more effective in clearing the mucus out of the lungs. With any of these techniques, it is advised to practice them for short lengths of time, several times a day, as opposed to practicing them once a day for an extended period of time. Because the idea is to clear out your airways and not tire you out. So rather than trying to cough for a half an hour and then being done for the day, little 5-minute segments throughout the day is going to be more beneficial at clearing out your lungs. So the first coughing technique, the deep coughing, you'd start by taking a deep breath, and then you hold your breath for 2 to 3 seconds, and you use your stomach muscles to forcefully expel the air. So you take a deep breath in and you cough it out. Now, controlled coughing is very similar to the deep coughing, but some people find it easier if they use their arms or their hands to kind of push on their stomach when they are moving, coughing up. So you take a deep breath in and then use your arms or your hands to push and try to push on your abdomen or your diaphragm and get the mucus out of there. Then you can rest and then do it again if you need to. And the specific answer we had on B for the quiz was huff coughing. That's when you can get air behind the phlegm, and that really helps to move it up that mucociliary escalator that goes up and down. So you're going to take a breath that's slightly deeper than normal, and then use your stomach muscles to make a series of 3 rapid exhalations with the airway open, making a ha, ha, ha sound. And that's going to help get the mucus from your small airways into your larger airways. And then you can get a good cough behind it, and then the mucus will come out of your airways. So we're going to take a deep breath. And then you can cough it out. Now, the third answer on the quiz was C, was airway clearance devices. And these are devices that help vibrate the airways to move the mucus up and out. And there are several on the market, and you can talk to your healthcare provider to get a prescription for one. Or those that become a Nightingale member, we offer the Aerobica. Now, what you do with this is you blow into it, you take a deep breath, and then you blow into it, and it vibrates in the lungs. And if I had phlegm in there, it would help to open that, move that around, thin it out a little bit, the number of oscillations or time it flaps. It helps to thin the secretions. It also will help for some people with COPD. You know how you have your trachea or your windpipe, and then you get your bronchi that go left and right, the big tubes, and then we get littler, smaller bronchial tubes. And as they go down and they get tiny, with COPD, they can collapse. So sometimes using a device like that, Aerobica, helps to open those airways. So I have people that say, I might not cough up a lot of phlegm after I use that, but I breathe better. I feel better. And that's why, because those tiny airways are now open again. And so it's easier to breathe. Now, there are other medical devices that do a similar thing to the Aerobica that are out there. The acapella, the lung flute, the flutter valve, those are all airway clearance devices. And then there are things that are sold on the internet. And I would just caution you to be careful and make sure that anything that you purchase on the internet is a medically approved device, and not some gimmick or spam thing that somebody, is trying to make money off of people that are vulnerable or that, are looking for some help. Now, there's a few other things that we didn't mention in the quiz that can help you to move secretions. Postural drainage. It's a way to use gravity to help drain the mucus out of your lungs. You change positions using pillows, and you can hold for like a minimum of 5 minutes in a certain position. So you could be laying in a bed, you might get your feet up, especially if you have like a hospital bed or something where you can get the head of the feet up higher than your head. It helps to drain. Sometimes when people get pneumonia in their right lower lobe, they can lay on their left lobe, and you try to get it so that the gravity really helps to pull the secretions or let them drain out of those lobes. Also, there's, and tying with the postural drainage is what we call physical therapy. And those are manual techniques. Typically, if you do it at home, it would be done manually. There are machines, especially if you're in a hospital, you might have had it done by a respiratory therapist, and there is equipment they have that will help to vibrate on your body. But what you want to do is you want to make a cup. You don't want to hit yourself like this and flat, and that's going to hurt and not do anything. So you get the air underneath your hand and you cup. So you can cup like this, and you can tell by my voice on my upper lobes here that I'm vibrating in there, and that will help you to loosen any phlegm that might be in there. You can do your upper lobes, you can do yourself on your side if you can reach. And if you don't have too much arthritis, you can get to your back upper lobes. Um, to get way in the back, you're probably going to need someone else to do it for you. You lay in the bed and they kind of clap on your back, and that can kind of help to loosen the phlegm from the walls and help again to help you be able to mobilize it. Another way to help move secretions is plain old exercise. If you're sitting in a chair or lying around in bed all day, you're not taking good deep breaths, and you are becoming more deconditioned, and it makes it harder to get the phlegm up. But if, I mean, just walking to the sink, to the bathroom, to the mailbox, getting up and moving a little bit every day is better for you than just sitting around all day long. A great way for people with pulmonary disease is actually pulmonary rehab. And so you may want to talk to your provider about that. Your pulmonologist or your regular doctor should know what's in your area, if there is anything in your area. Also, the next series of videos, Nightingale, we are working now on optimal breathing series videos that are on this site. But we also will offer, in the spring, we're going to have some videos on physical activity and moving. And Sarah, our health and wellness coach, will be showing you how to do some of those activities or exercise. And so, those may be a great option to do some movement. We're going to do exercises in a chair, and we'll have some that, people that you could work your way up, and you might be able to do more a little bit later. So I think that's going to be a real fun series to work on. Then there are medications. Now, again, you want to make sure with your doctor that nothing is going to interact with anything else. A common one for people with asthma and COPD, or even the common cold, is guaifenesin. It's an expectorant that helps to loosen the mucus so you can cough it out. And that is a good one. There is also your albuterol. Now, before you tell me, oh, wait a minute, my albuterol is not an expectorant. Albuterol is a bronchodilator, whether it's in your inhaler or whether it's in your nebulizer. And what it does do is it opens up the lungs by dilating the airways. And so remember when we had the model that being able to cough through something this tight is going to be hard, but if you open it up and relax it, so now you're getting it through this nice wide open airway, you're going to be able to get the phlegm up or the mucus out. So using your albuterol, people will say to me, oh, I take my nebulizer and then I cough up. And that's why, because now their airway is open and they're able to get it up. Also, people I find with bronchiectasis or cystic fibrosis will sometimes use what's called a hypertonic saline nebulizer, a fancy word for saying they just put saline in their nebulizer instead of medicine, and they just breathe in the salt water saline. and that helps to moisten the secretions, and then they can cough them up a little bit easier. Also, there are supplements that are out there. Now, remember, the supplements are not approved by the FDA, and you want to always talk to your doctor about any supplements you're taking so that you know that they don't interact with the medicines he's already ordered for you. That's the big concern there. And we have put in the chat, in the beginning of the chat today, the NIH, the National Center for Complementary and Integrative Medicine website, which is a government website that does has some approved scientific information about supplements on it and any alternative medicines that are out there. And because again, there's lots of information on the internet, but you want to be sure that anything you're basing your health on is accurate information and not somebody's way to make money when it's not something that's really going to do any good for you or could even harm you by interacting with something you're already doing. We also, another way to help moisten the secretions is humidification. Cool mist humidifier to keep the air from being too dry, which irritates the lungs, can be helpful. Remember to keep the humidity under 50%, as dust mites breed in a higher humidity. You also want to avoid warm vaporizers or aromatherapy, I would anyway, because both warm air and scents can cause bronchospasm in some people. And also clean your humidifier based on your manufacturer's directions. Some people find taking a warm shower to moisten the airways or breathe the mist in from a bowl or a pan of warm water. If the heat doesn't cause bronchospasm for you, so again, it's really knowing what works for your lungs, because some people find the really dry air or the really hot air is a trigger. Other people are able to tolerate it. I know myself, a nice warm shower, especially when I have a head cold or a sinus infection, really helps to drain the sinuses out too. I personally will use a bowl of water or a pan of water. I don't put the Vicks in it. I know some people are big on that. I just find the odor very strong for me, so I avoid it. But there are people that do feel that the menthol is beneficial for them. Air filters, irritants in the air can make you produce more mucus. So making sure that your heating and cooling system filters are clean and up to date is helpful. And then I know you hear this all the time, but the truth is smoking is an irritant. And that causes the body to produce thicker mucus and increase the amount of mucus in the airways. Nicotine, the addictive part of the chemical found in cigarettes, paralyzes those cilia or causes them not to work or to become very sluggish so that they're not getting the phlegm up because they're not able to move so quickly. Some people, when they quit smoking, do say, well, I cough more now than I used to. And that's because the cilia become sluggish when you're smoking, but then they come back to life and they start to work more effectively, moving up and down and up and down. And they're moving that phlegm up your airway and out so that it does help you to cough up and out. So it's good that you're coughing more afterwards if you're clearing out your lungs. So now we'll get to some of the questions. If any of you have put in any questions in the chat, I do have a question that was submitted before, and it's, why do I cough more in the morning? Several things happen while you're lying down all night. First off, the mucus pools in your lungs, and I kind of think of it, you're laying down and then you sit up, and then like a bottle on its side, and then you put it up, all the air comes up. Well, all the mucus comes up when you sit upright. Also, you haven't taken your respiratory medications overnight. So if you're taking a nebulizer every 4 to 5 hours while you're awake, and then you go to bed for 8 hours, now you haven't taken something for a good length of time. And so the airways can get a little bit tighter and the mucus gets stuck in the tighter airways, the narrower airways. So you take your nebulizer or your inhaler and open up the airways, relax it, and now you're able to cough and get it up. Caffeine, which many of us do have in the morning, is a mild bronchodilator. So it opens up the lungs a bit and it makes more room in the airways for the mucus to come up. For smokers, not having nicotine all night, those cilia might start to move a little bit more, causing the mucus to come up when you wake up in the morning. Because the nicotine that you have all day long is making them become sluggish. And then you don't have a cigarette for 8 hours or 9 hours. And now the cilia start to come alive a little bit. Smokers also can get a postnasal drip down the back of their throat, and that can contribute to a cough in the morning. So now, Cindy, are there any other questions? No questions. All right. Very good. Well, I want to thank you for your time today. I hope you found this session informative. And, certainly provide any feedback here, if it was helpful or not helpful or what you might like to see in the future. Our next session will be on March 30th at 10 a.m. Eastern Time. And Cindy, who I'm going to bring on right now so she can say hello, is going to be our speaker in March. And I want to thank you for your time, and everyone have a great day.